Hey everyone, welcome back to another episode of the Standards and Training Committee's podcast, Interpreting in Healthcare. Today I have an extraordinary guest to introduce to all of you with equally extraordinary goals that I'm really excited about.
Yep.
Let me tell you a little bit about our guest today. Dr. Imina Nosamiefan is a physician, a tent maker missionary, a language access strategist, and interpreter trainer, and founder of Interpreter Services Survey, a benchmarking initiative examining interpreter operations, costs, and quality across healthcare systems. With more than 15 years of experience in healthcare interpreting, translation, and program development, Dr. Nosamiefan brings a cross-sector perspective that bridges language access, emerging technologies, and policy. He is currently advancing an initiative to establish the first PhD program in medical interpreting, designed to strengthen academic research, leadership, and policy development in healthcare, language access, and to elevate the field to new levels of scholarly and professional recognition. What an exciting goal! Welcome to our
Absolutely.
podcast,
Absolutely.
Amina.
Yeah. Yeah.
I'm so happy you're joining us today.
Thank you so much. Thank you for the invite.
Well, let's roll it back a little bit before we jump into your ambitious goal of PhD for interpreting here in the US and talk about looking back. What was it with all of your training, your degrees, that made you decide, language access is where I want to be? What sticks out to you looking back that pushed you in this direction?
Interestingly, my path to language access, healthcare language access as a profession is well, I guess everyone's path is different, right? I say, as you said, I'm what you call a tent maker missionary, right? Well, what does that mean? I don't make tents, right? But that comes from literally from, well, Paul was a Christian missionary apostle, and he literally made tents to support his work. And so every missionary who does their, who's kind of bivocational, does their work to support them, their ministry, is called a tent maker missionary. So I was a missionary in Haiti for 5 years. So I'm originally from Nigeria. My language that I work in professionally is Haitian Creole. And how come? Because I was a missionary in Haiti for 5 years. So I learned the language. And coming to the US, both in health, with so I'm a physician by training with my, medical background, and then my knowledge in the language. So this was, I'm not even sure, prior to 2005, maybe 2004, I didn't even know that there was a profession called medical interpreting. And I'll talk a bit more about this. And I don't know how I got to find it, but it was a good melding of my two skills and passions, right? Um, um, you know, Healthcare interpreting or as helping people who don't speak the language of the provider is a great way to serve people, right? And so from my background as in people service, as a physician, as a missionary, and then it was just a natural move on, to combine all the skills to continue to serve people. Yeah, so that was my entry into the profession. And interestingly, if when you and then one of the ways that you ask this question is, how did you get into it, and all that. And in looking back, right, yes, I'm proud of, various things that we've done in the profession, but I'm also maybe even more proud of the profession itself, right? I say this very often. This is a very young profession, right? And especially whether in legal interpreting or medical interpreting. If you look at specifically at medical interpreting, you're in the room with people with who work in professions that established over centuries, right? Physicians, nurses, and social workers and things like that. So medical interpreting is often the new kid on the block, right? But I'm very proud of the profession because it has had to grow up fast, right? It has had to, um, a number of the hurdles that have taken in a lot of professions, centuries to establish, the medical interpreting or the interpreting profession. Let me just not just say medical interpreting profession, specifically since this is the context here is medical. Let me speak in medical interpreting. Has grown up pretty fast, right? Now, interestingly, this is a point that not many people will be aware of, but the first how do I call it now? Miracle of the Christian church was a miracle of simultaneous conference interpretation.
Oh, tell me more.
Yes, on the day of Pentecost. On the day of Pentecost, it actually says that now it says there were dwelling in Jerusalem Jews and many people, and then it says when whatever was happening, was happening, it says they were all bewildered and they were hearing one another in his own language. So as the apostle Peter was speaking, everyone else, it says, and they said literally, it says, are not all these who are speaking Galileans? How come we can hear them in our own native language? Parthians, Medes, Elamites, residents of Mesopotamia, Judea, Cappadocia, Pontus, Pamphylia, Egypt, Libya, Cyrene, and from Rome, Jews, proselytes, Cretans, Arabians. We hear them telling in our own tongues the mighty works of God. So,
I had never heard that before. That's
absolutely.
fascinating.
Yeah.
So the
Yeah.
opposite of the Tower of Babel.
Yes.
Everyone was
Yes.
hearing the speaker as if he
Yes.
were speaking in their language, like
Yeah.
the UN, but without the headsets.
Yes, yes, absolutely. So I mean, it's a very auspicious introduction to the profession. Like the first thing that God thought to do as a miracle in the Christian church was the miracle of simultaneous conference interpretation. So now we know.
That is my delightful nugget of new knowledge for today. Thank you for sharing that with me.
Yeah, absolutely,
So,
absolutely.
as we move into more recent times, what caused you to shift and come from Haiti to the US? You have a company, MedSapient.
Yes,
Tell us a little bit more
yeah,
about that. What are you doing here now before we
yeah,
talk about the future plans?
yes, yes. So our work now. The again, like I said, from the when you talk about the language access profession from the early times, like if you so very very quick run through history, right? And positioning myself in where we are now, right? And now you will maybe fill in some gaps here and correct me where I'm wrong, but I think that the prior to the 19 maybe it was 70s, there was nothing like medical interpretation, right? So the early foundations of this profession, are, I guess, ad hoc communication in clinics by by family members, right? You know, um, and then and then then 70s and 80s, the early training programs, hospitals in Boston, New York, and San Francisco, began to pioneer in-house interpreter programs. Now, correct, and like I said, this is my understanding, but so correct me where I'm wrong. And as a matter of fact, it was community interpreting that was recognized first, right? And the role of medical interpreter came out of general community interpreting. And fast forward 1986, the MMIA, it used to be called, and the Massachusetts Medical Interpreters Association is established. 1990s, 1995 is the Code of Ethics, right? Standards of Practice, 1995, 1996. So like I said earlier, this profession has had to mature, right? In has had to mature under the bright lights, right? Nothing like going off somewhere to figure this out. But as a profession, this has had to mature as this has been going on. And then trainings in community colleges and universities began to do certificate programs. Fast forward to the, let's see, late 1990s. I think that if I'm correct, the NCIHC was founded in 1998, thereabouts, yes. And then the Code of Ethics, 2004, Standards of Practice, 2005, and on and on and on. So national certification only came about in what, 09, 2010.
The pilot
And
tests were out
yes,
then, and I think it was only in 2010 into 2011 that it became widely available. And then it was still limited to Spanish, Mandarin, and Arabic before they
yeah,
developed the E2E, which is the test that tests in English
hmm,
many of the skills that you need in order to function at a high level as an interpreter:
yeah, yeah,
short-term memory,
yeah,
understanding of context,
mm,
understanding of HIPAA and the culture of healthcare in North America.
hmm,
We are
hmm,
unique compared to most places in the world in
hmm,
terms of
hmm,
how large a role insurance companies and what type of
hmm,
coverage somebody has in order to have access to the treatments, preventative or acute, that they need.
hmm,
And it is a lot for people to absorb.
yeah,
They were able to come up with a test that tests all of that: attentive listening, recall, understanding of context, the rules surrounding interpreting, so
yeah,
that we don't have to wait another 20 years to get the
hmm,
next 20 languages. There's
yeah,
way too
yeah,
many. The hospital I used to work at had regularly, on a daily basis, over 90 different languages being
hmm,
requested. So
hmm,
you can
hmm,
see that that timeline to roll out
hmm,
language specific tests
yeah,
for each and
yeah,
every
yeah,
language is
yeah,
going to take a really long time.
yeah, yeah. And with that is the core, and that's the core CHI certification, right?
Yep,
Yeah.
it is. And it's now called, if you take the E2E proficiency part, it's now the core CHI
Okay.
dash P, which is,
Hmm, hmm,
you could see on my name, as one of the first people to take
yeah,
that test.
yeah,
It's my language. I'm still waiting for that
yeah,
Portuguese
yeah,
specific test.
yeah. And I'll confess, I haven't taken it.
Well, it's a worthwhile experience, especially if you're thinking about developing trainings,
Yeah,
to see what people who have poured many years into research, doing the job task analysis to assess what are the tasks that healthcare interpreters are actually asked to do,
yeah,
and let's develop testing around that. And that job task analysis gets repeated every couple of
Yeah.
years
Yeah.
because the profession, as young as it is, has gone through some major
Yeah.
upheavals.
Yeah. Yeah.
We introduced video remote interpreting, which
Hmm.
at the time the Code of Ethics and Standards of Practice were written, didn't exist yet.
Hmm.
And now we have the introduction of AI assistants for capturing conversations with the captions and some automated processes, which I find worrisome because I don't think AI is quite ready yet. It is
Yes.
on
Yes.
its way and it can be a great addition, but until we are at the end point, I think automated interpreting or automated translation still needs the benefit of a human proofreader to look over or listen to that interaction to make sure that the context was understood. AI
Yeah. Yeah.
still lacks
Yeah.
the ability
Yeah. Yeah.
to
Yeah. Yeah.
finely distinguish
Hmm. Hmm.
context.
Hmm. Hmm. Kind of just to make a comment to that. Besides the context, there are going to be many scenarios in which it will be just completely impossible for for AI to facilitate the transaction. Take a complicated goals of care meeting, end of life conversation, and things like that, where you could have 13, 15 people in a conversation, right?
Exactly. Who is AI going to listen to?
Yes, yes, yes. Interpreter, social workers, critical care physicians, respiratory techs, for example. You have family members in the room. You have family members on the phone. Family members
On video.
on
Yes,
on Zoom. So that's a conversation in itself.
that's a
Um,
big conversation that we
yes,
need
yeah,
to try to have. And for that reason, I really am pushing for our organization to break out of the silo and forge new alliances,
yeah,
not just strengthen existing ones, but to make friends with people who write code, who
yeah,
develop programs
yeah,
for companies that sell to hospitals and language
yeah,
service providers.
yeah,
We
yeah,
need to all know each other and be able to have conversations with each
yeah,
other that
yeah.
are not uh, confrontational,
Mm-hmm,
but that
mm-hmm.
have the duty of care to the
Yeah,
patient in
yeah,
mind as we
yeah,
strive
yeah,
to develop a
yeah,
better product or
yeah,
service.
yeah. Synergistic partnerships. Yeah, yeah,
So that's my challenge right now.
yeah.
What's your challenge
Yeah,
right
well,
now in the present
well, so
moment?
yeah. So right now, various areas we're talking about. Interestingly, we're talking about air. That's an area that. So as we I want to position. I think that there is not just that I want to position myself, but there's a need for a a facilitator kind of position, right? Whereby the companies that are producing these AI products, for example, right? They're producing products and offering it to buyers of interpreter services. Um, and often the people who are making the purchasing decisions cannot tell, fake from real when it comes to the offerings. So so my metapians, we want to, for example, take a role, a middle, like a middleman role in a manner of speaking, to help purchasers understand what the producers of these AI programs are offering them, right? In the way of helping these organizations to figure out what is my AI readiness, what are my AI needs? How can I actually leverage, because AI is great, right? I use it a lot in what I do. So the question is, how can organizations safely and responsibly leverage the capabilities that are being made available for language access as the technology is developing?
Yeah, users of services need to have the benefit of some competency training.
Yeah.
And I think I'm have not yet been successful in doing this, but it would be wonderful if the salesmen for these services could also distribute with their product a basic booklet or slide deck that they can send online for how to partner with interpreters and what to watch out for when you're using artificial intelligence tools, what to
Mm-hmm.
be mindful of, like what are the guardrails so
Mm-hmm.
that everybody has the best experience
Mm-hmm.
rather than just going on autopilot and trusting
Yeah,
that AI
yeah,
will make the
yeah,
right decision.
yeah, yeah, yeah. Another area that the work that I'm looking at now is uh, I suspect, just based on just anecdotal knowledge and from my experience of 15 going on 16 years in this industry, that a lot of uh, interpreter services, especially when it comes to healthcare, is not very data driven. Decisions that are being made, it's not very data driven. So that is another area that we're looking at. We're looking to study the data utilization practices of of hospital and clinic based language access services, right? To with a view to coming up with kind of like a best practices, you know, manual, if you may, based on what we find is working in various places and what is not working in various places. All right. So yeah, so these are two big areas that I think that these are kind of like not even the next frontier, but what we need to urgently move into now.
Yep.
Yeah,
Currently, we need more data.
yeah,
The C-suite, the CEO, the COO, the CIO, and all of the
yeah,
people that
yeah,
really control the budget strings that trickle on down to all of the other departments, they're, and I don't mean it to make them sound hard-hearted, but they're not interested in the anecdotal story of how much the patients love the interpreters or how
yeah,
far they're
yeah,
willing to come because they
yeah,
know that interpreters are available at this
yeah,
particular location.
hmm,
They need data
yeah,
to support making the decision. And we also need champions that hold more sway
hmm,
with the administration, like physicians, to
hmm,
say,
hmm,
hey, I need a new x-ray machine. Well, I need two more interpreters
yeah,
for Somali and Pashto
yeah,
because
yeah,
that's what our patients are speaking, and we don't have
yeah,
enough
yeah, yeah,
to do for
yeah,
me to do my job. I
yeah,
didn't go to
yeah,
veterinary school. I went to
yeah,
medical school. I
yeah,
want to be able
yeah,
to communicate with my patient. So
yeah,
yeah, more
yeah,
provider champions, but
yeah,
more
yeah,
than anything,
hmm,
more data. The data will speak for itself.
yeah, yeah. Yeah, yes, yes. So these are two what I consider immediate and urgent needs that we're looking to position to you know to speak to or to meet. Yeah.
So how does this work? How does this dovetail with your vision of the future? I'm so excited about your um, goals to establish a PhD program for interpreting, despite the fact that I know how difficult that road will
Yeah,
be.
yeah,
If
yeah,
we
yeah.
don't try to get there, it's not going
Uh-huh.
to happen. So tell me more about that.
Yes, that is that is great. That is this is actually a thought or an idea that came from the last the last conference and the last conference in NCIHC conference, which that's where you and I met at in Arkansas. And it was a great conference. I enjoyed it. I love the city. I want to go back to Arkansas, and I don't know. Uh, I should say this. Yes, yes, absolutely. I should say this. I loved the city, and I want to go back. I'm a great biking, like in biking enthusiast. And on September 30, while we were there, they actually have a biking event, where you can do various, 25 miles, 50 miles, 75 miles, I think 105 miles. So, yep, yep, I discovered because I saw many people just coming in looking tired. And I said, where are you guys coming from? Yeah. So some guys had actually done 105 miles, right? So I will be back to Arkansas, to Little Rock, if not next year, maybe the next, right? I'm not sure I'm going to do 105 miles, maybe 75.
Maybe 7.
So anyway, um, there was, it was a great, I should say this, that it was one of the best conferences I had, attended. I've attended a few conferences. I enjoyed it. It was a great conference. So this is plugging NCIHC conferences. Anyone, who's in healthcare language access industry, you must become an NCIHC member, and you must be an active member. You must come to conference.
You
Yes?
heard it here, folks.
Yes. Yeah, no, yeah. So very lively discussion, and I think the weekend I got home, this just dropped in my mind that why not a PhD program in medical interpreting, right? Now, panaceas are not another thing, but if there's anything like a panacea in this regard, a PhD program in medical in interpreting would be like the gift that keeps on giving, right? Because it will answer to so many things, right? The profession needs the rigor of academic rigor. It needs research, right? And various other things, right? And so if you have people actively engaged in PhD level study and beyond in the profession, right? It will answer to a lot of the issues that we're trying to address. So I'm plugging this out here. I think that this for the profession, this is a must next step for us, right? And when you think about it, why not?
Absolutely.
Yeah,
There have been many efforts in terms of developing certificate programs
yeah,
that have grown into associate degrees and undergraduate degrees.
yeah,
But my heart was broken earlier this year when Middlebury College, formerly known as the Monterey Institute in
yeah.
Northern California, that offered master's level degrees in both interpreting, conference interpreting, translation, community interpreting, closed its doors. That was like a knife to the heart for me. So now,
Yeah.
if somebody wants to get an advanced degree in interpreting, the closest choice is the Glendon School, which is in Canada.
Mm,
So that hurts. The
mm,
US should be leading this effort
yeah.
because people come from all over the world
Mm,
to be treated at different hospitals
mm-hmm,
for
mm-hmm,
different types of cancers,
mm-hmm.
cutting edge surgeries, and they're Their national health care plans pay for them to come here to
Yeah,
get a
yeah,
treatment that's
yeah.
not available in their country.
Hmm.
So the rest of the world sees the benefit of cutting edge technology and healthcare treatment here in the US. We need to also have physically present the interpreter that will help facilitate and widen that pool of patients.
Yeah, 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 yeah. I mean, I didn't think actually, one of these things that you come across, you don't, pay closer, attention. I think actually, kind of, in the periphery of my consciousness, knew about this, the Middlebury closing, which makes this initiative just like perfect for this time, right? And so yeah, and I think that the NCIHC would be front and center in bringing this to pass. I know it's something you are passionate about, and yeah, so I think it's absolutely a must do for the profession.
So, all of my friends and colleagues out there who currently work at a university that offers training for interpreters, please reach out. I need to put together a mailing list of programs that already exist
Yeah, yeah,
for us to look at who would be the best partner to try to
yeah,
push that program to grow beyond its current level all
yeah,
the way to a
yeah,
doctorate.
yeah, yeah, yeah,
There's no
yeah.
time like the present.
Yes, absolutely. And interesting, yeah, I know I've boasted about the profession. One thing I've loved about the profession is that it gives you the opportunity to express, whoever you are, or the skills, or the proclivities that you bring, right? For me, while I've enjoyed the practice of interpreting for patients, but for me, the thing, one thing that moves me is finding a problem and thinking through a solution, right? And the profession has given me the opportunity to do this, right? Because it's still a young profession. It is something that young people, yeah, I'm a young person, young people should come into, because there's an opportunity. There are opportunities to express yourself, right? Uh, um, uh, I think I, I mentioned to someone a couple of days ago, computational, what is this, computational interpreting or interpreter? I can't even remember the correct name, but it's a new, it's a growing discipline in the language access industry, where you are teaching AI, for example, AI machines, right? So there are new opportunities. So this profession is certainly one for multilingual, not even necessarily multilingual people. There's room for just about everyone to come into this profession to express themselves. Um, to because we're still writing the book, right? We're still writing the book. So for people who are desirous to make a difference in an industry, this is one profession to come into.
And you can't beat it for flexibility in terms of hours. The way the US geographically is positioned,
Yeah,
we span so many time zones.
yeah, yeah,
And the fact that remote interpreting exists means that you want to work in the morning, you want to
yeah,
work in the evening, you want to
yeah,
work in the weekend, you want to work
yeah,
at night, or only during that time when your kids
yeah.
are in school. It's
Mm-hmm, mm-hmm.
possible.
Yeah, yeah,
And it is going to be at a better rate that you would be able to earn at any other part-time job.
yeah, yeah, yeah,
Creation of a degree program that leads to a doctorate would
yeah,
also allow for greater growth within the field.
yeah,
Once you
yeah,
come in as an interpreter, you can work as a freelancer or you can work as having regular hours for an agency, or
Yeah.
you could step up and be a staff interpreter at a hospital. But
Yeah.
once you're a staff interpreter at a hospital, where do you go? There
Mm-hmm.
doesn't seem to be much
Mm-hmm.
room
Mm-hmm.
for upward growth
Mm-hmm.
unless we create those steps by requiring certification,
Mm-hmm.
training that goes beyond the bare minimum of the
Yeah.
40 hours
Yeah.
of bridging
Yeah.
the gap, and
Mm-hmm.
pay bonuses for,
Mm-hmm.
have a certificate? Do you have an associate degree? Do you have a bachelor's degree, a master's, a doctorate?
Yeah.
And
Yeah.
that opens up the doors to being more than a interpreter or a trainer, and to helping lead those language access programs.
Yeah. Yes. And language, access professionals should be in the C-suite, right? Patient experience. Absolutely. No reason why not. No reason why not.
Not to be called to the table as an afterthought after
Yes.
you've re-rigged your Epic registration
Yeah.
software and only now realize that you haven't updated the list of countries because
Yeah.
someone in interpreter services is
Yeah.
pointing out. We need to be there at the beginning and
Yeah.
not
Yeah.
at the end when the announcement is made.
Yeah.
And the only way
Absolutely.
to do that is to increase our professionalism, and
Yeah.
also to increase our alliances, to
Mm-hmm.
increase our circle
Mm-hmm.
outside of language services,
Mm-hmm.
so that
Mm-hmm.
people go, oh yeah, maybe shouldn't someone from interpreter services be here when we reconfigure a registration? Wouldn't that be nice to be able to identify a patient as needing language assistance
Mm-hmm.
from their first contact so that
Yeah.
they don't fall
Yeah.
through the cracks?
Yeah. Yeah. Absolutely. Absolutely. Yeah. So the future is, you know, with I know there's a lot of anxiety, but I really think it's unfounded, anxiety with the emergence and growth, and metastasis of AI. But I think that it bodes well for the profession.
It
I think
does.
it.
And there was a lot of anxiety when video remote interpreting was first introduced, not just on the part of the providers who were worried about the quality of the interpreter that they would get at the other end, but
Mhm.
by the interpreters themselves, like, oh, I don't want to be on camera. Now I'm going
Yeah.
to have to wear makeup every day.
Yeah.
But all those smaller concerns really fell by the wayside when they were trained and had the opportunity to practice before you
Yeah.
threw them in front of a provider and a
Yeah.
patient.
Yeah.
And interpreting is interpreting.
Yeah.
And we're having
Yeah.
a wonderful conversation, and it doesn't really matter that we're not both in the same room.
Yeah.
And
Yeah.
people came to see that. And then
Yeah.
COVID cemented the use of remote interpreting for all of those that had resisted up until then. And
Yeah.
it's not an issue
Yeah.
anymore. And I
Yeah.
really do feel that AI is going to end up
Yeah.
being very similar. It's
Mm-hmm.
just that, like I said about being present when they reconfigure Epic, I,
Mm-hmm.
as a language service provider, want to be present as they grow their large language models and develop their AI algorithms, to help ensure that we have that quality that you would expect. And I'm such a nerd that, I read the subtitles when the movie is in a foreign language and my husband is reading in English. I always catch when there's a mistake. That's
Mm-hmm.
not what he said. He said
Mm-hmm.
this, and the
Yeah.
subtitle showed
Yeah.
that. So,
Yeah.
so never
Yeah.
watch a movie with subtitles with a translator or interpreter if you expect to get through without any interruptions. So,
Yeah.
but
Yeah.
we can get there. I
Yeah.
mean, we
Yeah.
got to the
Yeah.
moon. AI is not as big a challenge, I don't think.
Yeah, 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 yeah. So these are exciting times, So, fellow, language access professionals, these are exciting times. Let's grab the bull by the horn. Let's jump in the fray. Let's embrace AI. Let's learn about it. Let's become the consultants, or uh, let's become who we are, the experts when it comes to healthcare language access. Let's become the go-to people, and nothing about us without us, right? And the path to that is for us to become knowledgeable. Let's not wait. Let's not wait necessarily to be invited. Let's put ourselves front and center.
Absolutely. The time is now.
Yeah,
The time is now, people. We can do this.
yeah,
We just have to pull together.
yeah, yeah.
So I thank you so much for joining me today,
Thank you
Dr.
so much
Nosamiefan.
for having
You have taught me something new and you have recharged my batteries
me.
for something that I know won't be easy,
Yeah.
but is definitely worth the effort. So thank
And
you.
it's doable. It's doable.
It's doable. Thank
Eminently
you for
doable.
joining us.
Yeah.
And don't forget, we'll be launching another podcast soon with another exciting guest. So tune in.
Thank
We
you so
are on
much.
our website as well as on YouTube. And I'll be
Great.
seeing you soon at the next event, Dr.
Yes. Yes,
Nosamiefan.
definitely looking forward
Bye
to it. Bye
bye.
then. Yeah.